So these muscles are, these muscles in the neutral position are not really engaged, but they have some level of resting tone or tension, okay? So they're prepared. When you have movement, so this vertebra is then moving to the left, and this one is moving relatively to the right. What ends up happening is the disc gets slightly warped. The outside fibers of the disc get angled. This ligament on this side and this ligament on the other side, they both become tense. So they get basically elongated to a particular position and they're supposed to stop. And what they do is they stop the motion between these two bones. In the neutral position, like I said, these ligaments are partially lax. They're prepared to allow for some movement in either direction. And when that movement reaches its maximum allowed, due to the healthy length of the ligament, this motion stops. So it's a passive stop of the motion. And these muscles have not undergone any stretch that would force them to contract. Does that make sense? Now, if I go this way, so we've got the normal situation again. We experience an injury here, whether it's a whiplash or a concussion. Both of them require momentum, and momentum requires deceleration. So things need to be slowed down. And what slows things down when we have momentum injuries are either ligaments passively or muscles actively. And muscles can either be engaged by you going, oh crap, and holding onto the steering wheel, or when they get stretched, they'll respond. Unfortunately, when you experience a trauma like a car crash that you're not expecting to experience, the response time of any given muscle in a normal human being is 0.3 of 1 second. But the amount of time it takes for a car crash to reach its peak acceleration, which is when the movement is maximized, is 1/10 of a second. So that means by the time your muscles have responded to try to protect the ligaments from ripping, they're 0.2 of a second too late. And this is why people sustain permanent ligament injuries and result in a chronic pattern of requiring treatment. And so this is one of the things when people have been in car crashes, I see a lot of practitioners, massage, chiro, physio, they'll basically do the allotted number of treatments for a patient and then basically release them saying, well, I did my best. They're not fixed, or maybe they feel a little bit better and they feel good about themselves and the patient gets released. However, that patient starts to seek other therapies because they're not better. And the reason they're not better is because they've sustained permanent ligament damage, which results in, and I'm going to explain this in a second, which results in a permanent accentuation of the tone of these muscles that causes them to always stiffen up and always have soreness and ache in a particular area. Because if it was just general overuse, they'd have hypertonicity everywhere. But most of these people have specific areas where they're hypertonic, and not hypertonic in the sense they've had a stroke, but just this phenomenon where it basically becomes sensitized due to the phenomenon I'm going to explain to you in a second here. So again, we have normal, we have trauma and injury. What ends up happening then, the normal situation here is that the disc is slightly bulged out. These ligaments here on the outskirts are slightly stretched out, so they're no longer this length, they're this length plus a factor of X. So let's say this length here was 2 centimeters, and here now they're 2.5 centimeters. So 5 millimeters of stretch in the ligament that it's never going to recoil back to that 2 centimeters and then heal. So any healing that happens in this phenomenon here is by way of scarring, but in the elongated position. So if you've ever seen a piece of baking paper or wax paper or parchment paper and you stretch it out, if it doesn't rip, there are parts in there that are weaker and they'll actually stretch out and become more transparent and bubble. Have you all seen that, whoever's baked here? So that bubbly area is literally the same thing as a ligament. So that parchment paper was maybe 15 centimeters long when you've stretched it out. Now it's 15.4 centimeters long. And so and it's never going to recoil back. And the same thing with ligaments. So now when this phenomenon, so say somebody's got a desk job, their head's hanging forward, they have anterior head carriage, this vertebra is going to shift this way, and the other one the other way. And then what ends up happening is this disc is still warped, as you see here. This tension point here happens 5 millimeters later than it did over here. So because it's happening 5 millimeters later, all of a sudden, where the tendon attaches to the bone, so you've heard of the Golgi tendon apparatus? So that sends a signal into the spinal cord. The spinal cord responds by sending an alpha motor neuron efferent response to the muscle itself. The muscle contracts to try to bring this back to that 2 centimeters, because that's normal. That's expected. This muscle then relaxes when it's accomplished that 2 centimeter pullback, or that 5 millimeter pullback to 2 centimeters. And then if the person's head is still in that position, because this ligament tightens up at 2.5 centimeters, it's going to drag that 5 millimeters again, sending again a stretch reflex in through here and back down to contract. This becomes a perpetual cycle, involuntary. And as that continues to happen more, all of a sudden there's something else in these muscles called the muscle spindle. And the muscle spindles measure stretch, but they also measure velocity. So the stretch in a particular direction and how fast it's happening. So then the muscle spindles start to send information to the central nervous system. So this is supposed to be the guy's head and brain. And in there, it sends a gamma motor neuron response back to that muscle, which changes its tone. So its resting level of tension changes. And as this perpetual cycle happens, in order to give these guys a break, this entire muscle alters its tone so that this gets governed at 2 centimeters and it doesn't allow that 5 millimeters to go. But any muscle that has reached that state is basically in a living state of rigor. So basically the cross bridges have locked down. There's tons of lactic acid built up in the area and it's painful. And the range of motion is limited because there's no give in this. It's a rigid muscle now. So you can try to override that, and my colleagues do that often, trying to manipulate through that, and it occasionally flares people up. And the reason it flares people up is that you may get the crack or the cavitation, but now you're actually forcing a stretch into this muscle that is locked down to protect. Does that make sense? And because it's locked down to protect, it needs muscle work. And I found, and I'll explain why I found, that acupressure or sustained pressure techniques, and the number one technique that I use, and I don't adjust people very much at all, chiropractically. The number one technique I use is called NIMO, receptor tonus technique. And it basically, if you boil it down to the simplest definition of it, it's acupressure. Okay? Sustained pressure, which forces the lactic acid out of the muscle fibers, but the pressure itself causes a release in those bridges if it's held long enough. And long enough, in my experience, is 20 seconds. And I'll hold sometimes people's trigger points for literally a minute. And when that release happens and the lactic acid is squeezed out and the lactic acid is held squeezed out, so the lymphatic system can actually scavenge it, pick it up and remove it. And then when I release that spot, basically it's caused a reset in this neuromuscular system. And so now this muscle can then again be responsive. So this muscle never got weak, it got rigid. Okay, so muscle strengthening exercises to one of these muscles when they've reached their rigid state to basically protect this whole phenomenon from happening are not amenable to exercise. They're not amenable to stretch. And this is why, if any of you have known anybody who's eventually had injury and eventually gone for active rehab and whatever else, and they've done stretching and they've done exercising, they've generally been flared up. And especially as it pertains to the upper neck, that flare up often includes nausea, dizziness, ringing in the ears, balance issues, visual changes, sensitivity to light, sensitivity to sound, all concussive-like symptoms. And the reason that is that upper cervical spine, so C1 and C2, they're supposed to govern the position of your head at any given time. And you've heard of the suboccipital muscles, I hope. So those 4 suboccipital muscles are the most richly innervated with spindles. And the reason that is they're supposed to protect the position of your head all the time. And there's even something called a cervical ocular reflex. Have you heard of that? So there's a cervical ocular reflex where there's an actual connection between your eyes and the suboccipital muscles. If you look at somebody slow motion and you film them slow motion, you say, I want you to turn your head to the left. The first thing that happens is their eyes track, and then their head follows. And because their eyes track, and the brain thinks the head's going to follow, the suboccipital muscles engage to try to neutralize that rotation movement. And so if someone's got a desk job and they're just tracking all day long, they're literally working up their suboccipital muscles. And if their suboccipital muscles are already fried because they're trying to stabilize instability from an injury, it's going to be an override of symptoms.